This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hey, everybody. Welcome to Ageless Health with yours truly, and we're going to have an interesting program. But beforehand, I want you to let you know that the holiday season is very special, always has been for me. And Christmas for us, and going through the new year, and we start back at Thanksgiving time and so forth. It's amazing how things begin to shift and slow down and sometimes, kick up a little bit. So here's the deal. I want you to take a deep breath of air going into this holiday season. I want you to forget about all the slings and arrows and all the ugly and all the nasty that's taken place that you interpret that way. And maybe the lack of appreciation that we have for people who think a little differently than, how you think, how we think. And embrace them and love them and have enough respect for them to allow them to have that platform. Because, I grew up in a world where, particularly being from Sicilian family, that from Thanksgiving on, we're very engaged in high level decibel arguments when it comes to all kinds of things. But a day later, 2 days later, a week later, for the next gathering, the next holiday party, everybody was, back at kissing and loving each other. And they say, I think you're wrong, but I love you anyway. It's okay. It's good. So please, please bear that in mind. And coming up Wednesday is Hanukkah, and Christmas starts on Wednesday, and it's an overlap. And, let's understand that we are one family called mankind, and that we need to love each other. And we all have different experiences. We all see life a little differently. It's like, you look at an elephant, the old story, right? And everybody has masks on, they're blindfolded, and they're touching the elephant. One's got the tail, one's got the trunk, one's got the back end and the leg and so forth. And that's their whole perspective of what the elephant is. And if you're in the rear end, and it gets to be really shitty sometimes, right? Well, that's life. That's the way it happens. But understand that that's that purpose, that's person's perception. And if you change that perception, you see it a little differently. The whole idea is to try to get as many perceptions as you can, so that you get a bigger picture, a bigger story, and be able to move forward accordingly. It's important. And I wish that for all of you. That's my gift, that going into the Christmas season, the Hanukkah season coming up this week, that's, we extend our love to everyone and try not to make them wrong because we want to make ourselves right. That's the problem. We want to make ourselves, as the only viewpoint. That's not okay. But let's get into the program. We want to talk a little bit about headaches and where they're coming from, but it's foot pain. And foot pain and headaches, they have something in common. I'm here to tell you that if you ignore your feet when it comes to headaches, you're never going to fix anything. And, we talked a little bit about that on the radio program just a moment ago on WMAL 105.9 FM in the Washington metropolitan area. And by the way, all of our programs are available by going to drtomroselle.com. And just go to, at the upper right, you have live stream and you have podcasts, you download them. They're all there. So, check it out and make sure that you missed it, you weren't there, they're available for you. Now, having said that, let's get into the program just a little bit, right? We're talking about your feet and how it affects your healthcare but more importantly, your head. Not a lot of people realize that even though that your feet are like way distant from your head, what's that got to do with my pain and my migraines, my headaches, even neck and shoulder pain? And it's very intimately connected. Your back, your hip, your spine, all of those things, they're a balancing act, right? Your feet are your foundation. And everything above that is based on how your feet are. And we're not talking selling you orthotics. I'm not telling you to go get a heel lift. There's times when those things are necessary. But what's causing the feet to break down and you don't have the balancing act that you should? So let me take you through the process a little bit. If you're going to fix, and we talked about this many times, in different programs, if you're going to fix a window on the third floor that keeps breaking, the frame cracks, the window cracks, and so forth, then you keep replacing the window, it tells you that there's something you're missing, correct? Well, that missing piece is the foundation of your house. And you may be having part of that foundation break down, and subsequently, it's not supporting everything above it. Your feet are the same way. If your feet are breaking down over a period of time, you need to look at the feet. You need to fix those, those dog's ears. So, there's more support above that. So here's one of the things, and just, kind of an interesting thing that we do with patients. Anytime anybody comes in with neck and shoulder pain, but particularly with a headache, whether it's a migraine headache or a tension headache, I put them on the table face up and I put their hands back like this to the side and I test the head neck muscles. If the neck muscles inhibit, meaning they weaken, then I have them bring their toes like this without bending their legs up towards their face. And then I retest the muscles. You know what happens the greatest majority of the time? Those neck muscles that were weak, inhibited, if you will, using the term correctly, now they're strong. And it's like, oh my gosh, what just happened? So there's an intimacy in the gait pattern Now, I want to remind you that coming up on the 22nd of January, at the Roselle Center for Healing, Dr. Harlan Brown and I were going to be talking about your head, neck, and shoulder problems as it relates to your feet, and your low back problems as it relates to your feet, and your skeletal system as it relates to your feet. And I'm going to show you that if you don't fix those things, and by the way, so many of you know Dr. Browning, the professor, if he was, we lovingly call him, because he's amazing when it comes to the intimacy of how the structural system of the body works from the foot up, if you will. And you're going to find it fascinating. So, by the way, bring your bad shoes, and we're going to show you some things. I'm going to show you how they may be weakening you, and you think that they're good stuff, but they may not be. So we'll do some testing. We'll do some demo. We'll show you exactly what the problem is. And then we'll show you how it relates to neck muscles and neck and shoulder problems and head pain and so forth. There's patients that, they say, well, if I'm quiet and I'm sitting around and so forth, I don't have a major problem. It's there, but it just, it's tolerable. But as soon as I get up and I start walking around, it becomes much, much worse. That's called a clue, right? That's called a clue that you have some other things that haven't been addressed to fix the situation. If you, if you get up and, you bend over and your headache gets worse, that comes from a different part of the body. But you have to differentiate what really goes on. But here's the deal. We talked a little bit about it on the radio program. When you look at the feet, we'll pretend my hands are on your feet because you can't see the rest of me here unless I get up, and then I'm going to mess things up in the office here. So if your thumb is your big toe, right? The inside part of your nail on your big toe is the beginning channel for what? It's the beginning channel for the acupuncture channel for the liver. And it goes from here, and it goes all the way up, and it actually ends on your chest right over the liver, but it's bilateral, it's on both sides. I know your liver's only on one side, on the right side of your body. But if the foot is irritated, if the arch is dropped, then that channel energetically is not going to function properly. And it can cause congestion, if you will. That's why sometimes, you see that big toe throbbing. It's called gout. And the knuckle, if you will, on the big toe gets swollen and kind of turned in. That's called liver function. And the rest of the muscles begin to break down and not work the way they're supposed to. So when you look at the body, particularly when it comes to somebody who complains of a problem in a postural pattern, when they're upright, you've got to check the feet out, because that's the pedal base. I said in the radio program that, a lot of this can be a neuropathic problem, diabetic neuropathy. If you look at the legs from the knee down, and so we'll pretend my elbow is the knee, and it goes all the way down into the feet. You want to look at all this, right? If you have like a little bit of swelling, but it looks like the skin is tight and there's no hair on it where there's hair every place else, that may be a primary indicator that you have diabetes. Why is that going to affect the foot, or how's the foot affecting that? Well, let's go back to the big toe again, right? My thumb. On the outside of the big toe is the acupuncture channel that relates to pancreas, and it could stimulate or inhibit the production of insulin. So I know I'm being very superficial, but I want you to think about these things, that your feet, the muscles of the feet are primarily important, and you can't just put supports in them. You can't just beat them up with what's called a percussive deactor, one of those machines that does this all the way up and down. You have to treat it multidimensionally. If you do that and you get it done repetitively enough, it'll change. You know where we have the biggest problems with patients is that sometimes they don't want to cooperate. They don't want to do, it's too much, it's my lifestyle, I don't have time. If you say, listen, all I want you to do is I want you to stretch a little bit every morning. I want you to rub your feet from your feet all the way up to your body, to the knee, moving things energetically the way they're supposed to, the lymphatic system, the waste disposal system, the way it's supposed to, up towards the body. But the patient tells me, I don't have any time. Well, why don't you get up 5 minutes earlier and do that? And then at lunchtime, take 2-3 minutes and do it again. And at nighttime, take 2-3 minutes, do it again. And then you can do these things that can make a big difference. If you go to a book on foot reflexology, for example, you're going to notice at the bottom of the foot, okay, these are my toes, right? And at the bottom of the foot, right about here, there's a channel called kidney. Kidney meridian is your energetic source. And any foot problem worth mentioning, that point, that channel, that energetic is always involved no matter what. There's other points as well, but you also have to check that. If you don't check that, you can't move anything. It gets stuck, meaning energetically, it gets stuck. So when you look at the pedal base, your feet, right? We refer that to your pedal base. We know that after decades in practice, that it can be coming, these headaches, these migraines, these neck and shoulder problems can be coming in part from your feet not being balanced the way they should. And then the muscles that are associated with your feet, if you will, are not working the way they're supposed to. Then that can be spinal related. That can be a lot of things, but you got to find out which is which. It's not okay, right? It's not okay just to say, oh, I'll go get some orthotics, or I'm going to go take two Excedrin. Now, if you've ever had an injury to your body, particularly to your ankles, you've twisted your ankles, you've jumped off of something too hard. Ladies, unfortunately, you wear those crazy spikes like this, and when they should be way down like this and then balanced all the way across. The fashion industry makes so much money off of who we are relative to our, I want to look good, I want to see these calf muscles, I want to say, go work out, go to the gym. Okay, I know that's me saying things that are obvious to you. But when you have these injuries, when you have the diabetic patterns, when you got way too much weight around your midsection, it's going to cause problems from where that weight is into the pelvic girdle, into the legs, all the way down to the feet. When you're on your feet, prolonged standing, like, yours truly, I'm treating patients all day long. And so I could be on my feet 7 hours, 6 hours without sitting down. And if I don't have good support, if my muscles aren't strong in my legs, if I don't take care of those things, trust me, by the end of the day, I am one hurting unit. How many of you do the same thing? How many of you look to sit down, and not because your back's bothering you, but your legs and your feet are killing you? Think about that for a minute, because it's going to motivate it all the way up, and it's going to cause problems with your head, neck, and shoulders. So your sore feet can be so much more, particularly when it comes to your head. If your headaches get better when you lie down, that's called a clue, right? And if it hurts sharply when you're standing, walking around, that's called a clue. If you get up and you just stand on your feet, and I'm not talking about dizziness, I'm not talking about anything, but all of a sudden, you feel like you want to vomit. Now, why would that happen, you ask? Well, should you ask? I will give you an answer. Why that happens is because the acupuncture channel for what? The stomach starts on and ends on the foot. It starts right up here. It goes all the way down. So it's always intimacy and interconnectedness that we're looking for if you're going to be able to do it the right way, meaning fix you so it doesn't come back again. But guess what? Here's the other piece. I need you to be able to understand. That's why we do the programs. That's why we do the live stream. That's why we have lectures in-house. That's why we take the time and really go through things. That's why we ask patients to go to rosellecare.com and look at the patient orientation video that's there. We used to have patients, we do in the office all the time. But when the more information that you get, and then if you ignore it, that's on you. That's on you, because these things can be fixed. I've been in practice well over 4 decades now, and I see things that are so automatic for me to look at. But unfortunately, for so many of us, we don't get it. So the thing is, I want you to get it. I want you to understand that there's ways of fixing these things and making a difference. you know, your feet are pretty far away from your head, right? So you wouldn't think that there's a problem there. But it's very likely that those feet, those dogs of yours walking around, could be causing your migraines and your headaches and your neck pain. And if it is, we check out other parts of your body as well. You got to look at, your low back and your hip and so forth, because there's a whole intimacy of neurological hand and glove that is putting this thing into a symptomatic process that you don't want to deal with. So why don't we think about coming up, January 1? I don't want you to make a New Year's resolution. What I want you to do is I want you to make a commitment. We're going to talk a little bit about commitments next week. And we're going to show you how to walk through this. I'm going to show you what a commitment really is. It doesn't mean you're perfect. It means that you're committed to making something different. Commitment means you're burning the bridges behind you, that you refuse to go backwards again, that you're going to take a step forward. You're going to take, 2-3 steps forward, and you may only lose 1.5, but you're still moving forward. You're going to take another 2-3, and this time you might keep 2. You can take another 2-3. This time you may keep 1. But pretty soon that journey gets you to where you're supposed to be. So, we're talking about your feet, right? So when you have these dogs that are aching you need to understand that it's causing other problems as well. So we need to go out. We need to check it out. We need to find out what the deal is. But you have to commit that you're going to do something different. You don't need to stay on drugs all your life. You don't need to have that ongoing tweaking. I was the guy that when I heard that Robert Kennedy Jr. was going to be on health education, head, or was going to be the health education head, I said, yes. There's a lot of things I don't agree with his politics other than that, but nonetheless, this guy is your friend when it comes to your ability to make a decision and choice. And this is what you have to do. Understand that you have a choice. You have a choice of getting better and understanding the platform that brought you to this place of pain, i.e. your feet. And you don't have to take diabetic medication the rest of your life if you understand what was causing it. That you don't have to have surgeries if you understand what was causing it or willing to turn around. You don't have to take the Botox injections in your head to get rid of your headaches. You don't have to take the anti-inflammatories and so forth if you're willing to make a difference. But difference when it comes to your feet truly embraces what we call the structural, chemical, emotional platform, the injury, the biochemistry, and the stress patterns. So little tweaks, little changes can go a long way in resolving virtually everything and anything that happens to our body. Now, we're getting in a lot of different areas. There's so much I'd like to cover. We'd be here the rest of the afternoon talking about it. But, understand that if your feet are involved, your headache increases with movement or standing positions or postural changes. Your headache hurts sharply when you're walking around, and it's like you don't want to move too fast. When you stand up and you're on your feet, you get that queasy feeling that you want to vomit. When you get a foot massage, all of a sudden your head feels better. Why is that? So what we want to do is we want to give you the tools. And on January the 22nd at the Roselle Center for Healing in Fairfax, we're going to do that. Now, having said that, I want to take a couple of minutes and really, truly wish you, your family, and your friends a wonderful and blessed holiday season. For those of you who are truly of the Christian belief, Christmas is very special. Remember what it's about. For those of you who are celebrating Hanukkah, it's a very special time. But we need to cross those bridges. We have to make sure that we enjoy each other, we love each other, we forgive each other, that we don't get into these push away situations. where I don't like you anymore because you think differently than how I think, that you're not welcome in my house because you're not on the same platform that I am. I only want those things around me that are supportive and like my thought process. We have to make sure that we get away from that. Trust me, in my family, in the Sicilian family, there were fights from Thanksgiving all the way through, but they loved each other. They embraced each other. There's nothing that they wouldn't do for each other. They wouldn't segregate or push away from each other. And if there's anything that we need to pray for as a society, that's it. Having said that, remember January the 22nd. Remember this week, Hanukkah and Christmas start on the same day. And I'm here every week bringing you a little bit of different information for one reason only. I love you. Don't forget, by the way, if you have forgotten to do last minute shopping, go to the Angels Health Store at drtomroselle.com and pull it down. There's water filters there. There are nutrients. There are things for your face. There's sunblock, things that we approve and so forth. It's a great opportunity to kind of fill in the blanks and tell them that you need to get it in the next couple of days or at least by New Year's Eve. And what you do is this. So if you forgot the gift, you get a little card and you say coming soon, and said a surprise is coming. I didn't forget you. Just the post office is ridiculous, and do that. So that's how you cover yourself. You cover yourself up. But go to drtomroselle.com. And then the last thing I'd like to encourage you to do, Caring for Others is a foundation that I started back in 1998. And this time of the year, we take care of the shelters and women and children battered and abused that have no other place to go. We'd love to have you help us. Donate today, just whatever you can afford, whether it's $5 or it's $5,000. Please help us help others. I appreciate you. I love you. Happy holidays. Merry Christmas. Happy Hanukkah. I'll see you soon.